Hello everyone, welcome back to my channel. My name is Becky Sechere. I hope you're all doing well. So in today's video we're going to be talking, or I am going to be talking about some of the non-bedside nursing roles in the UK. So if you would like to know more about that and how much they are paid, why not watch to the end, and remember to subscribe as well. See you in the video itself. Hello, welcome back to my channel. My name is Becky Sechere. So if this is the first time you've come across my video, you are very welcome. I'm a nurse working in the UK. I trained back home in Ghana before coming to practice in the UK, and I've got a lot of experience and information, and I feel I can share with you if you're new overseas nurse in the UK and you like to know anything that would help you on your journey whilst you start working in the UK, as well as newly qualified nurses who are already working but not too sure what opportunities are there in the future. So this is for all of you. Remember to hit that subscribe button if you are happy with what you hear. Anyway, so let's go straight to the video. So there are two categories. Anyway, when we talk about nursing, we all think you have to be by the bedside, working in a hospital or in a care home. Yes, definitely, there are people who enjoy being by the bedside of patients and looking after them. And there are others who prefer to work as non-bedside nurses. And both roles are very important. We complement each other, I would say. I have been out of the bedside since 2009, so I work Monday to Friday, 9 till 5 in my roles since 2009. I do miss the bedside nursing, but you know, I'm still making a difference in whatever I do. So as I said, we complement each other. Anyway, so there are two categories: either hospital-based non-bedside nursing roles and non-hospital-based non-bedside nursing roles. They're a bit confusing terms, but I believe you understand what I'm talking about. So I've made my list, so I'm going to be talking to you through them. So most often the hospital-based non-bedside nursing roles are paid on Agenda for Change Band 6. So as an international nurse, when you come to the UK as an OSCE nurse, you've completed your OSCE, you can't apply straight away from overseas as a non-bedside nurse or specialist nurse. You would have to work in the UK at least for a year, 18 months, or up to 2 years. Gain your experience in the UK, how things work here, before you can apply for a non-bedside nursing jobs. Most of these employers would want some UK nursing experience before you can apply for these roles. So there are several roles in the hospital. As I said, they're usually on band 6. So some of them I'm going to be talking about are the specialist nursing role. Before we talk about specialist nursing role, you can work in a hospital in an outpatient department, and that is a non-bedside nursing role. So nurses in outpatient departments are actually band 5, and band 5 salary, as we all know, is about 25,600 and something per annum. Anyway, so most specialist nurses work Monday to Friday. Sometimes it can be 8 to 6, or it could be day shift. So you don't have any extra money to top up as compared to someone who is working on the ward and they're working night, they're working weekend, so they get a little bit extra, what we call unsocial hours allowance, something like that. So those of us who do not work by the bedside, we don't get those extra, so we just get dry money, I call it. So anyway, if you're band 6 specialist nurse, their salary starts from 32,306 to about 39,027 pence per annum. That is annual salary. So they divide it, take tax and all that, then you take home whatever is left. And some of the specialist nursing roles or non-bedside nursing roles actually are band 7. You can get band 8. So it ranges from band 6, which is the beginning, to band 7 or 8. So one of them, as I said, is like a gynecology specialist nurse. Every system, the human body system in the UK that we care for, has a specialist nursing role attached to it. So as I said, gynecology specialist nurse is one of them. Actually, theatre nursing is another one. You're still by the bedside, but not as someone who is completely off the bedside. You can also do something like working in recovery or day case, but day case nurses are also band 5s. However, you can become a senior band 5 or you can become a band 6 in day case, although not many band 6 nurses are in day case places. We have rheumatology specialist nursing role. So I'm talking about the hospital-based non-bedside nursing roles now. So rheumatology, dermatology, we have respiratory specialist nurses, we have epilepsy nurses, we have multiple sclerosis specialist nurses, there are Parkinson's disease specialist nurses, we have sickle cell specialist nurses, we have lymphoma nurses, and there are different types of hematology specialist nurses. Apart from lymphoma, some have head and neck cancer specialist nurses, there is breast cancer specialist nurses, there is urology specialist nurses, we have stomach care nurses, specialist nurses, cardiology, HIV specialist nurses, headache specialist nurses. So my new job that I have gone for is a headache specialist nurse. So don't ask me about headaches yet. In a few months I will be giving you more tips, but currently that is the job I've just started about 2 weeks. I'm only 2 weeks into that role now. There are research specialists or research nurses as well. And as I said, the pay for specialist nurses in hospital starts, or the banding is from band 6 to band 7 or 8. When you come to the UK and you're newly registered, you start from band 5. Okay, so let's carry on, and I'm going to talk about the non-hospital based, non-bedside UK nursing role. So one of them is health visiting. So health visiting, to become a health visitor, you should be a registered nurse in the UK, other adult, children, mental health, or whatever. So far as you're a registered nurse in the UK, you can apply to become a health visitor. And to become a health visitor, it is another degree, and when you finish, you would actually get another NMC registration, which is Specialist Community Public Health Nursing registration. So the public nurse health or health visiting course is about a year, and most hospitals do, or hospital trust or community trusts do advertise for these roles. And when you apply and you go on the course, it would be fully funded. You will be paid most often as band 5 whilst you are studying. When you finish, you would be, and you meet some of the your competencies, you become a health visitor. So health visitors look after babies from, actually I would say from pregnancy, part of the pregnancy throughout till when the babies are born. They do the baby checks, and so it's a community work. You have to be a driver and all that. So they look after 0 to I think 55 yeah, 0 to 5 years old. I may be wrong, but that's what they actually, their age range, they look after child development and all that. They look after child development, safeguarding issues, and it's a beautiful job, but can be very challenging, especially with the safeguarding aspect of it. And then another one is school nursing. So school nursing as well, to become a school nurse, you would have to be a registered nurse in the UK. Then you apply, you could get sponsored to do school nursing course. It's also another degree. It also gives you public health or a specialist community public health nursing registration on the NMC register. And usually when you also studying, you are sponsored, you are paid as band 5, and when you complete, you start as a band 6. So that is another one. And then you can do practice nursing as well. So that is general practice nursing. So that one, some people actually go straight through general practice as a nurse. After qualification, they apply to any GP practice. They start working. Whilst they're working, they actually get trained to do the job. And so they start as, you can start at band 5, and some of the, or most of the GP surgeries, they pay you depending on your skills and experience as well. So you can negotiate your salary. They look after NHS patients, but most often privately run. So you would have to check the contract and what they offer. And if you're happy, you go for it. Another one is to become a nurse practitioner. So a nurse practitioner or advanced nurse practitioner, most often they work in walk-in centers, urgent care centers. Some of them work in GP surgeries as well. They look after people with minor ailments or illnesses, and they do consultations. All of them are majority or all of them are nurse prescribers, so they do consultations, they do prescribing, and some could be band 7 or band 8. And the course, you have to do a course to become an advanced nurse practitioner. Sometimes when you're working at a practice or somewhere, you could get sponsored to do that, or you can do it yourself. There is an MSc Advanced Nurse Practitioner course. And when you finish, I think it's a 2-year course. And when you finish, their salary is from 40 to 50 or more thousand per annum. Health visiting, school nursing, when you finish, as I said, is band 6. There's another one. You can become a nurse educator. So either you are teaching in a university, but you need to have your master's degree. It's desirable because the nursing training in UK has been a degree course for some time now. So you would need to have your master's degree, or in the process of doing your master's degree, all you need to do is look on most of the university websites, go on Google, search for, nurse educator or tutor in some of the universities, and you would find a job and you develop yourself while you're doing it. Some of them, they start paying them from 40,000 and above. So it's the salary progresses as you get experience. Another job you can consider is 111 clinical advisor. So instead of when there is an emergency, life and death, we call 999 in the UK, but certain ailments, if you're unable to see your GP, or it's not something that is an emergency that you need to go to A&E or accident and emergency, you would ring 111, and when you ring 111, there are call handlers or advisors who triage and will tell you, oh, you need to see this person, you need to go here. We will send a doctor to your house, or we would send something, or things like that. Most often, you should be a trained nurse, or you should be a paramedic in the UK, and then you can apply for that. Most of them, you're trained on the job, and salary can start from 32,000 to 40 or more per annum as well. Another job I found is functional assessor or disability assessor. With the disability or functional assessor course, It is also a non-bedside nursing job. Physiotherapists can do that, nurses can do that, paramedics can do that. You are trained on the job to do this particular job. So assessing people who have some medical conditions or disabilities which prevents them from working, so they're on benefits. So sometimes every 6 months or annually or biannually, they are asked to be assessed to see whether things have changed. So that is the job. I wanted to do that some time ago, and I spoke to a few people and I was told it's quite challenging, but you never know until you go into it. So, they train you as to what to do. So far as you do your job well, I think the difficulty is the fact that you are making decisions on somebody continuing to collect or receive their benefits, or them being stopped, or their benefits being reduced. So that can make it a difficult decision. Now, another non-bedside nursing jobs that nurses can go for in the UK are like pharmaceutical sales representatives or reps. So they do sales for pharmaceuticals. If there are some new drugs and things like that, you go and talk about them to specialist teams in order to make sure they're using your medications. Another job here is medical device sales representative. So nurses can go into that and help in, training staff and patients in using new medical device as well. Another one is insurance nurse or insurance screening nurse. It is not a common thing in the UK, but there are jobs there as well. Not many, but it's something you can look at. They could earn about £22 to £28 per hour. The screening nurses could be used by insurance or occupational health teams. You go to someone's house, you take bloods and do certain screening, blood pressure and things like that. So those are some of the jobs. And then another non-bedside nursing role is occupational health. So occupational health as well, there are two ways you can work as an occupational health nurse in the UK. Either you apply, some hospitals do advertise band 5 nursing roles for occupational health nurses, some band 6. You can go into that. Whilst doing that, you train on the job and do the formal training as well. There is also a degree in occupational health nursing or a master's or postgraduate diploma in occupational health nursing. You can do that. And when you complete that, you can work for companies and doing the screening, sickness management, accidents on site. You can work for construction companies. You can work for railway companies or several other companies, in addition to hospitals as well. So the Metropolitan Police, they do recruit occupational health nurses as well. So that is another role. Their salaries normally in the NHS, as I said, there is band 5, band 6, and then outside of the NHS they are not banded. So you could be earning maybe 35 to 45,000 per annum or more, depending on your experience. So that's another one. So the occupational health nursing course is about 1 year if you're doing the degree. Another job is travel nurse, is another one. And then there is live-in nurse as well. So there are live-in carers, and then there is live-in nursing roles as well. So that one, you live in somebody's house, you are providing nursing care to that person in the comfort of their own home. If you have experience in tracheostomy and all the specialist care needs or assessment and provision of care, you could get those sorts of jobs. I've seen an advert and they can earn about £1,460. That doesn't take into consideration your tax, so they might take some. So it's still not too bad. And then there is a community nursing role as well. So most trusts, community trusts, or not acute, so I would say community trusts do have community nurses. So community nurses, you have to be a driver. You should already be working in the UK, and You would drive to people's home and also delivering care. It could be giving an IV medication, not common. Most often it could be taking blood, it could be wound dressing, it could be assessing the home environment, it could be end-of-life care provision. Some, it would just be checking people's BMs and giving them insulin, and different sorts of treatments are given by community nurses at home. So a lot of driving. There is a community IV nurses as well. Some of the drug companies or pharmaceutical companies do employ nurses who go to people's homes and give chemotherapy care or IV drugs as well. So it's something to look into. I don't know the salary for that, but most often it is within band 6. Some of the companies actually offer you company car whilst you are doing this job. I think I am almost getting to the end of the list that I have. So it's quite fascinating. Nursing is not only bedside job. You can do a nursing job as a non-bedside nursing roles, and you're still contributing in your own way. We have education. You can become a nurse blogger or vlogger or a freelance writer, and so many. So there are a lot of opportunities if you're a nurse to explore. So why not look into this? If there is any topic you would like me to talk about, feel free to drop that in a comment section. If you have any questions, feel free to also comment, and then I would get back to you. I hope this video has been helpful to you. For those of you who are considering coming to work in the UK as a nurse, or you're already here, you are working at the bedside, which is very good, but you may be considering, okay, what other options are there for me? You can consider working as endoscopy department. They do endoscopies and they do all the investigations. So it's a day case setting. So it's an area you can look at. There are several areas. There is DVT specialist nurse. There are nurses into health and safety, patient safety and all that. There is infection prevention nursing roles. They are based in hospital most often. Some are community based as well. Their role can be banded between 6, 7 and 8. So there are many nursing opportunities. I couldn't mention all of them, but these are some of those that are available in the UK. You can think about if that is what you would like to do. So anyway, I hope you enjoy the video. Have a lovely day, and I will see you soon. Take care, and remember to subscribe, like, and share as well. Bye-bye.